The mysteries of multiple sclerosis. While there is no known cure for MS, there are therapies that may slow the disease and help you maintain a normal quality of life. Here to discuss that is Dr. Wanda Castro, a neurologist at UConn Health Center who specializes in MS. Doctor, thanks for joining me.
Thank you for having me.
So let's start off by talking about what is multiple sclerosis. It's an autoimmune disease, right?
Yes, it is an autoimmune disease. Basically, your body's it's attacking yourself.
Okay.
And it affects mainly the brain and the spinal cord. Sometimes also the optic nerves are involved most of the time. And basically, in people that are predisposed, they have some genetic background, may have this condition.
Now, doctors can't pinpoint a cause, but we can talk about the risk factors. So let's address that.
That's right. So we don't know exactly what causes MS, but we do know that you need to have the right genes. Once you have these genes, something in the environment triggers your first attack. Sometimes they're viruses, sometimes bacteria, sometimes something in the environmental exposure.
So what are the symptoms?
Symptoms of MS, the most common symptom is usually optic neuritis or visual loss, could be partial or total. Patients can also have double vision. They can have a stroke-like symptoms. One side of their body becomes weak. They can also have weakness and numbness that start in their toes and go all the way up to their torso. And those are usually the most common symptoms that will lead to the diagnosis.
But MS is also commonly misdiagnosed, and that's a scary thought, because you're saying that early diagnosis can really mean the difference between using a wheelchair and not having to use a wheelchair.
Definitely. And I think one of the things that I have seen in my experience is a lot of women are the ones that have MS in the 20s to 40s.
More women than men.
More women than men. And what happens is, like, most of these women have been labeled as hysterical because you have numbness, tingling. MS patients can have depression and anxiety. So they've been, oh, just take some Xanax and keep going. And at the end of the day, it's been 5-10 years when they've been having this condition and no treatment.
Wow. Speaking of treatment, let's talk about what you can do.
Well, basically the treatments are all injectables. There's one oral pill. But the treatment, we know that patients that respond well to therapy, they don't have to be in a wheelchair. And that's something that I always tell my patients. People are scared about MS and being in a wheelchair, but if you respond to therapy, you're compliant with your therapy, you don't have to. The treatments are injectables, as I said, 4 of them. Then we have one IV, and we have a pill.
Now, when patients come into your office, I'm sure some of them have been misdiagnosed, and then they come into your office and finally they get that clarity. I can't even imagine. So I would just assume that if someone doesn't feel, I mean, I'm sure you would feel that something's still not right, then they would get a second or a third opinion.
Yes, and I totally agree with that. I tell the patients, you know, the sooner you can get the diagnosis, so if you don't feel comfortable what your doctor is telling you, just take it someone else. And make sure they have an MRI and they can do some further workup to make sure this is MS or something else.
Dr. Castro, mucho gusto. Thanks for coming in.
Oh,
I appreciate it.
Oh,
nice
same here.